joining us for our next edition of the University of Mississippi PharmChat series. Today, I am joined by Doctors Andrew and Lauryn Smelser, who are both pediatric clinical pharmacists at the Children's Hospital at the University of Iowa. Good afternoon.
Hi.
Hey.
Could you both tell us a little bit about your backgrounds, kind of where you grew up, you before the pharmacist you?
Yeah. You want to go first?
Sure. I was born in Minnesota, but I was raised in Huntsville, Alabama. Went to high school in Huntsville, and always knew I had an interest in medicine. My father's a physician, and so I was interested in medicine, but didn't necessarily want to work the hours and the commitment that he did. And I knew there were a lot of different routes that you could go into medicine. And so I shadowed as a student, as a 13, 14, 15-year-old student, a bunch of pharmacists, and really found myself drawing back towards somebody named Patrick Newman, who's at Huntsville Hospital. And I didn't know if it was because I really liked him or I really liked his area, which was pediatrics. And so I kept coming back. And as I was about 17, I was like, all right, I think I really like this. I also really like him. He's been one of my mentors through this process. But so I went into college going, I want to be a pediatric clinical pharmacist. And here I am about 10 years later, actually in practice now. So did my undergrad at Ole Miss and did my pharmacy school at Ole Miss as well.
That's awesome. And Lauryn?
Yeah, so I was born and raised in the coast area, Gulfport, Mississippi. Lived my whole life there, love the coastal water atmosphere. I went to Gulfport High School and graduated 2011. That sounds right. Sounds like a long time ago.
Yeah, 9 years ago.
But kind of, I think what a lot of people say when they go into pharmacy is, I want to help people. And I kind of think along the same lines as Andrew, is that I'd always been interested kind of in the complexity of the medical field, but really wanted like a specialized niche. And I felt like pharmacy was a good place for that. And so I had a hometown pharmacy that I really liked and got to shadow them and see what pharmacy is all about. And then as I kind of progressed through the early entry program at Ole Miss for pharmacy, and then finishing pharmacy school at Ole Miss, I really also found myself drawn to pediatric patients and being their advocate, but with an additional interest in the oncology component, because there are a lot of super complex parts about oncology and the treatments and the genetics behind it. So I took a class at Ole Miss. The first, I think, med chem class was kind of had some oncology pharmacogenetic basis. And I just thought that was super cool. So that's kind of what drew me into like pediatric pharmacy and really more so in oncology or even any kind of complex disease state in pharmacy, is you learn so much about it. So yeah, that's kind of my journey through figuring out pharmacy and undergrad. And now here I am.
Sure. So both having attended Ole Miss for undergrad, is the pharmacy program what drew you to Ole Miss specifically, or did you always kind of grow up knowing you would go to Ole Miss or wanting to go to Ole Miss?
I didn't even know. I actually, the funny thing is, being from Alabama, it's either Alabama or Auburn. Those are the only two you have, and no one else goes anywhere. So I graduated with a class of about 450, and 4 people went to Ole Miss. Actually, no, maybe 3, but I found one of my leaflets of like a college fair from my junior year, like middle of my junior year, in my closet about halfway through college. And it had like all the places that I had checked all and like marked off, and Ole Miss had been like totally striked through. Wasn't even considering it until we had a family friend that was that graduated from Ole Miss, was like, hey, just go take a look. And they have a pharmacy program, and knew I was interested in it, and got to meet Dr. Wilson at the time. Went over there and met him and got a tour of the school, and loved the campus and knew I was interested in it. I knew I was interested in early entry. I had a few other different options, but I got into early entry, which Lauryn did as well. And so that drew me in and kept me there. And so that's why I went there initially. That was for sure. It was not even on my radar. I didn't have anybody, no family go to Ole Miss or anything like that. Most of my family went to Auburn. So it was definitely a change.
You broke the mold.
I did, yeah, but I have broken the mold to where my family really loves going to Oxford and really enjoys coming to Ole Miss, and cheers for us and Auburn as well.
There you go. The Grove's a beautiful place.
It is, absolutely.
Yeah. I would say kind of a similar situation. My family, my mom went to Southern Miss. She really wanted me to go there. It was her alma mater. And she's like, oh, you could be an Eagle. And I'm like, no.
Do I want to?
But I would say early entry is definitely also what brought me to Ole Miss. But I went there for a leadership summit after my junior year of high school. And like, similar to Andrew, where I thought, no, Ole Miss is just not going to be for me. But I went through this summer program and saw the campus. And a lot of people say you see Ole Miss and you fall in love with it. And it's so true. It felt like home. It felt like a good place where I could grow into the person that I wanted to be. The atmosphere, the beauty of the campus, everything just felt good. And then when I interviewed for early entry and found out I got it, I was like, this is such an easy decision. Ole Miss it's the place for me. And some of a lot of people from my high school and in my graduating class went to Ole Miss. They're like, oh, I don't know if you're going to like it. And I'm like, I don't know what you guys are talking about. This place is awesome and it's going to be great. So it's been the best decision to pursue undergrad and pharmacy school in a place like Oxford and at a university like this.
Yeah, I also interviewed there and got there. It actually snowed the day we interviewed, of all things. It snowed, and not many people. Back in 2010, I interviewed in February, and Dr. Wilson was running a little late with some of the people that were there, and I got stuck in a room with two other people, Jensen, now Carr, and Jordan Michaels, and we ended up talking, and they ended up being two of my best friends all the way through school, and still friends today. And like, they're still our best friends. So it's just funny how everything comes now 10 years later, comes full circle.
Absolutely. 10 years away from where you were then, for students who are on the fence about whether or not to pursue the early entry program, what advice would you have for them?
Yeah, I would say that's something that's unique about the pharmacy track at Ole Miss and about pharmacy in general, is that it's a commitment, and it's a commitment up front, especially for the early entry program. You have those commitments to keeping your grades up and being in good standing. And I'm sure that a lot of students, I was concerned, like, how is this going to affect my college experience? I think is what a lot of people are concerned about. And I found some of my best friends through pharmacy school and through like my community in the college in general. You do have those specialized classes that you have to take, but there are a lot of students in those early classes who are in other disciplines who I still keep very close connections with. So I feel like that the early classes especially really still keep you diversified and plugged into the university. And that's how I would encourage people to continue to make friends within your early entry class, but also those who may be pre-pharm and are interested in doing pharmacy school, or who are in other disciplines like nursing or pursuing med school. I still keep up with a lot of those people, and my classes were a great way to do that.
Yeah, I'd say it's a great idea to go in, because it gives you, obviously the guaranteed seat in pharmacy school is really, really nice. Not having to re-interview is also a great sticking point, but it's nice because you have a guaranteed idea of at least what you think you want to do. We take all the prerequisites that everyone else does, and if you find out you don't absolutely love it, you can go into any of the other medicine subspecialties that you would want to. I would say most people usually stick with it, but there are a few here and there. It gives you a great baseline idea of medicine and biology and chemistry, and to where you can apply it to anything that you wanted to do. But I think that the path really set us up well for pharmacy school, and really set us up well for other paths, because I have other friends that have gone into other paths that have done really well from our starting point as well.
And I think that what some people miss early in pharmacy school is the diversity of the profession. So you may come into early entry and decide, I want to go back to my hometown and become a part of my community pharmacy and integrate myself into this person who's been my mentor. And I think that that's an excellent goal, an excellent perspective. But you may get into pharmacy school and realize that you enjoy closed door pharmacy, or you maybe think about doing nuclear pharmacy or hospital pharmacy like we do.
Or industry, or there's so many things that you, as a high school student, or as most people, don't even know that pharmacists can do. Pharmacists are creating their own jobs in many different fields at this point, in terms of going into pharmacogenomics and going into administration in pharmacy schools. There's so many things you just don't know about. There are even positions in pharmacy that I am still learning about right now after having been a pharmacist. So there's such a great realm of possibilities out there, like she said, even within the field of pharmacy that are still evolving and will still evolve moving forward.
Absolutely. I've been very pleased, and it's been very fun for me to get to learn through these pharmacy chats a little bit more about all the different areas that our graduates end up in, because it is so much more than when I initially began this job. I thought my CVS, Walgreens, Kroger, maybe a hospital here and there. And I've just learned there's so many more opportunities for pharmacists. There's kind of something for everyone, if you will.
Yeah,
I totally agree.
With that, can you tell us a little bit about your own personal experience within the profession?
Yeah, so I kind of explained my interest early on, was kind of more towards a clinical basis in pediatrics. And I had a mentor who was my long-term research project advisor, who was a pediatric pharmacist as well. And he kind of sparked my interest through my research project about getting involved in pediatrics. And that kind of comes with the decision of how do you go into residency to get specialized training for that? I think is a big question. And pediatrics is a unique in that there are two different tracks you can take, and Andrew and I took both of those, two different routes to get to kind of the same place. So I did a first year of pharmacy residency at the University of Iowa that was primarily adult based. And my reason for that is I wanted to have kind of that baseline knowledge. A lot of pediatric practice is based off of what we do in adults and how we treat adults. And so I personally wanted that time to grow and learn how to be a pharmacist, and learn kind of those baseline principles of adult practice in several different areas before pursuing a second year pediatric residency to be a little bit more specialized and learn how children are unique and how their care is unique. So I did a first year and second year residency, and then I'm a pediatric clinical pharmacist now, I'm primarily ICU based, so pediatric and neonatal ICUs.
Yeah, and I did take a different route. I went through school, and I obviously knew I was interested in peds from the start. I actually ran for the SSHP presidency position and lost, and was trying to figure out a way that I could get involved in leadership. And my mentor at the time, Ashley Crumby, who's now on staff and is teaching the pediatrics elective, who I actually just talked to today, she encouraged me. She was like, well, there's a group called PPAG. It was PPAG at the time. Now it's PPA. It's the Pediatric Pharmacy Association. It was like, well, they're introducing student chapters. And you could start one here. And so I was like, all right, that sounds like a great idea. Let's do it. And so we started the PPA chapter at Ole Miss, and that kind of jump-started my pediatric interest into something that was real. So I went down to Jackson and kind of focused my rotations on pediatrics as well. Did PICU and a NICU rotation, and another rotation at another children's hospital. And so I ended up going to residency at the Children's Hospital of Alabama and did a 1 year only in pediatrics. So I kind of skipped the whole first year in adults. So I haven't treated adults in now like 3 years. So not since I was a student, I haven't treated adults, but again, two different ways to do it. But after residency, we ended up getting married. And so actually towards the end of my residency, we got married, and she was a year behind me. So we got married in May, and then the next year she moved to Iowa, and the next year or the next month I moved up to Iowa and took a position as a pediatric clinical pharmacist up here. I was very fortunate to step into a position up here that someone was retiring, and my position is currently in focusing in general pediatrics, primarily endocrine, GI, and nephrology, but also I cover a few different subspecialties as well. And then we both do a little bit of operational pharmacy. We work down in the central pharmacy as well.
Awesome. So I find it, you mentioned getting married amidst this about 10-year road. Can you tell us a little bit about how you met? Did you meet in pharmacy school or just in undergrad in general?
Yeah, so that's a great question that we love to tell. I was a second year pharmacy student. So it was my last year in Oxford, and Andrew was a third year student who was helping with our like kind of introduction to the Jackson campus day.
It was Jackson Visit Day. Which I don't know if they even do anymore, but they did. They did as P2s or PY2s, I guess.
Yeah.
So I did not want to come at all because we had like 3 tests that week. I was very stressed, and I'm like, I don't know what I'm going to get out of this, but we had to go. So we went, and
I didn't have to be there.
Yeah. Andrew volunteered to help with Visit Day. Didn't have to be there at all. He's like, I'm just going to go help. And we had kind of, we had similar friend circles. Like his friends in pharmacy school were in my sorority in college. And so I knew him, and
we ran in similar circles, but never really.
We like to say adjacent circles. They overlap sometimes. So I had been kind of like bumping into him all day, and we were going to get back on the bus to head back to Oxford, and I had to stop at the vending machine because I needed some caffeine to study on the bus on the way back. And Andrew walks up to me, and we just start chatting, like, what are you doing for the summer? He was about to start rotations, and I was doing an internship at Vanderbilt, and Andrew was doing a rotation at Vanderbilt over the summer. So we were going to be there at the same time. And I said, oh my goodness, we need to be friends. Like, I don't know anybody in Nashville. I barely know the people who I'm staying with, their family friends. And so he sent me a Facebook message and got my number, and now we're married.
I did it out of the kindness of my heart. I was there that day. But little did I know that I was going to find a wife out of it. So it was well worth my time.
There you go. The message to everyone: do things.
Volunteer. That's what you need to know. It may lead you down a different path than you thought.
Absolutely. So other than giving you both your spouses, what would you say is your favorite thing about pharmacy school and the profession in general?
Yeah, I would say one thing that I really appreciate that pharmacy school gave me, I know the curriculum's a little bit different now, but during our third year, we did a lot of kind of independent and autonomous learning and working through problems. And I feel like that's what I enjoy most about my job, and also happens to be what I feel like the most impactful thing that Ole Miss gave me was the ability to work through complex problems. If someone asks me a question and I don't know the answer, which happens a lot, even still as a pharmacist, you have to be comfortable with understanding that you don't know everything. And I feel like my lessons in school and things that I learned and my background knowledge really taught me how to investigate a problem and come up with an evidence-based, guideline-based, even in pediatrics, case report-based answer to questions that I get asked a lot. And I enjoy the complexity of pediatric patients and the questions that they have, because a lot of what we do is not necessarily backed by a ton of evidence or guidelines. So you end up having to find literature to support what you're doing. And it really just comes down to your problem solving skills. So I feel like that's what I enjoy about my job, and also what I feel like Ole Miss taught me to do.
I'd completely agree with that. I think we found school very challenging, as most people do. Our first and second year were pretty challenging. Third year was incredibly challenging, and we knew that. But third year, we hated it while we were in it. We definitely did. But
hate is a strong word.
It was accurate, but But
really disliked.
I say this to say on the other end, once we've talked to classmates now, and we were so thankful that we were given the ability and the challenge of problem solving as our third year. I mean, we take a class called problem solving, or at least we did. I don't know what they do now, but we took that class, and we had to teach ourselves a little bit through the problem-based learning sections. And we again hated it while we were doing it, but now we find that we're really, really good problem solvers. I've found working with different students from other schools, we found that the students aren't as good at problem solvers as we feel like we are, as we feel like we were prepared to be at Ole Miss. And that's where I feel like we really came out ahead, because we know primary literature. We know, especially in pediatrics, like she said, a lot of times we don't even have any primary literature, or if it's a primary literature, it's just a case report. That's all we have to go up. There's not many randomized control trials when it comes to pediatrics. So we often have very little evidence to go off of it. And that's what the fun part is in pediatrics, is because you really have to use your brain, and you really have to try and rationalize a lot of different things to come up with what's best for the patient.
Ultimately, what he's trying to say is the challenge is worth it.
Isn't that what I said?
Yeah.
I think that's what I said.
I took that away from it. Absolutely. Speaking of challenges, how has COVID-19 and the current climate affected your day-to-day, both at work and then just at home and being a family? What changes have you seen?
Yeah, I'll go first. So because we both primarily work in the hospital, I would say that it actually really hasn't changed much.
We have to wear masks and face guards.
Yeah, we wear masks and face shields on the floor, so that can be a little bit cumbersome and uncomfortable. But for us in the hospital, it's been business as usual. You still have patients that come in and need to be taken care of. We're very fortunate in that pediatric patients don't seem to be as susceptible to the really bad complications of COVID. So we haven't seen a lot of pediatric cases. We've seen much more on the adult side, but it has created some challenges in terms of we get adult overflow. So that's why we feel really grateful to be able to work through problems, and me having an adult background to be able to know what those max doses are. So I can consult with my pediatric providers and say, like, this patient is adult age and adult size. Like, we need to have a conversation about how to treat them like an adult, because sometimes we get overflow due to other ICUs being full or other floors being full. So that's kind of created some challenges for us at work.
Yeah, our day-to-day in terms of work hasn't changed a whole lot. But like Lauren worked a shift from home today because we have a little bit of overlap in some of our pharmacists when they have project days to be able to work. Normally those would be at the hospital. She was able to work from home today and do a little bit of that. That doesn't happen very often. It's usually if we have specific projects in areas, like she has some PICU projects that she needs to get done. That's basically the only thing work related that has changed besides wearing masks. From home standpoint, obviously we live up in Iowa. Our families are down in Alabama and Mississippi. So it makes it a lot more FaceTime calls and seeing our friends through FaceTime.
A lot of time together at home.
A lot of time together at home. Yeah. So that's primarily, we're very fortunate to where it hasn't really impacted us as much as some other people. But we were very fortunate in that aspect.
That's good to hear. With that, I feel very fortunate that you all have taken some time out of your evening to share with us, and I don't want to take too much of your time. So if you had one piece of advice to leave a student who's on the fence about whether or not to pursue pharmacy versus one of the other medical disciplines, what would that be?
You want to go first?
I know that's a big one. You can have a second to think about it.
If I had one piece of advice to give someone who is considering early entry or even pharmacy in general, is that we are such an integral part of the medical team. What I enjoy a lot about my job is that I'm able to work in an interdisciplinary care team. Like, I have nurses who need medications that they need to administer. I have physicians who have questions about how to order things. As an inpatient pharmacist, I also help bridge the gap to outpatient pharmacy. I also work with social work if there's any kind of insurance issues, dietitians, for other considerations for medications. And I like that I feel like I'm kind of like the glue in the middle of the team where I can talk to any one of those members of the team about patient care and help solve problems. So I think that pharmacy is very unique in that we get to work with all those different disciplines all in one day. That's kind of more towards the hospital pharmacy type of thing, but even in the community, you get to work with different disciplines too, different providers who all are prescribing medications for your one patient. And as the pharmacist and you're filling and dispensing those, that takes some communication between providers to know that, hey, this patient's on this medication and it interacts with this. Have you considered that? Or can you talk to this other physician that they see? So you kind of sit in the middle and act as the glue. And I feel like that's very unique to pharmacy.
I'd say two things. One is the variability that we've already talked about, the variety of things that you can do, and the challenge. So in terms of variable things that you can do, we've already talked a little bit about it. You can go into hospital, you can go into retail, you can go into industry, you can go into closed door pharmacy, open door pharmacy. You can even open up your own financial firm or financial business. There's a podcast that I listened to called Your Financial Pharmacist. He was a pharmacist that just had an interest in finance. And so he has now a fee-based financial consultant. He has a certified financial planner, and he runs a podcast just because he is a pharmacist and had an interest in it. That's just one example of lots of different things that you can do. I think within pediatrics, the challenge, and within any field in pharmacy, the challenge of constantly learning keeps you on your toes, and it keeps you humble, because there's always drugs that are coming out. There's always studies that are coming out that you're not going to know, and you're constantly learning. So constantly learning from your colleagues and constantly learning from your students that are coming through on rotation. I can't tell you how many things that oftentimes my students will say, hey, there's this study about this, usually adult study about something. And I haven't heard about it because I don't take care of adult patients as much. We learn from our students just as much as we can teach our students. And the constant learning and constant evolution of pharmacy is what keeps us, what brought us here and what keeps us here, honestly.
That's awesome. Well, thank you both for taking some time to share your experience and insight for both our current and future, hopefully, pharmacists. We appreciate you both.
Thank you.
Thanks so much.